Hello, I'm Dr. Olga Bukholts of Perfect Smiles Orthodontics, and I'd like to talk to you about a wonderful product that I have been using for years called Invisalign Teen. So if your dentist has referred your child to be seen by an orthodontist, or you yourself are seeing an issue and are considering what types of treatment are available for your child, please consider Invisalign Teen for the following reasons. Yes, conventional braces are still available. However, Invisalign Teen offers the following benefits. For most people, it is actually a lot more comfortable appliance. So there are less discomforts after adjustments, there are less complaints, nothing is poking, nothing is breaking. So from that perspective, a lot of our patients find it a lot more comfortable. And some people even compare what they used to have as a teenager, when they had braces, and now that they're in aligners, it feels a lot better. Secondly, your teenager will be able to brush their teeth normally without any impediment. And if you have had your braces yourself or had them for your other child, you would probably know that keeping your teeth clean with braces is quite a challenge. It's not impossible, but it is quite difficult. Thirdly, your child will be able to eat whatever they want. And that's kind of a big deal for all of us, right? Because you don't need to think about that popcorn at the movies or potato chips or pizza or bagels or anything else. You can have whatever you want because the appliance is removable, which none of that you can have with braces. Another great point is a lot of our children are busy, they're into sports, they're playing musical instruments, and braces are a little bit of an impediment to that, because with sports, a ball can break a brace, cause a trauma. Some musical instruments, proficiency is impeded by a person having braces. None of that is true with Invisalign Teen. For you as a busy parent, you have to know that your teen will have to come for in-office visits a lot less often than they would with braces. With braces, I see my patients every 2 to 4 weeks. With Invisalign, every 8 to 12. So literally your child will be set up for 3 months ahead, but every week as they switch from aligner to aligner, their teeth will start looking better and better. And last but not least, emergencies with Invisalign Teen are a lot less common than they are with braces. Again, because no matter how careful people are, inevitably sometimes they bite on something that will break a brace. The brace becomes loose, becomes bothersome, a wire becomes pokey, and that usually happens on a Friday night. So none of those issues are evident with Invisalign Teen, because it's something that is removable, something that is smooth, and the most common emergency is a person loses an aligner. While that sometimes happens, 9 times out of 10, a person can jump forward and start using the next set of aligners. If that is not a possibility, either because the aligners fit too tight or you do not have the next set, we always ask you to keep one old set available, and you can step back, call the office, and we will replace the set that is missing. And up to 3 of these occurrences are at no additional cost to you. Another common objection that I hear from parents is, well, my child will not be consistent, they will not wear it. And while that is true for a really very, very small minority of children, teenagers, and even adults, a more likely outcome that they will appreciate this much better appliance for them, and they actually will wear it. And it's also not at all uncomfortable, so they most likely will wear it. But in the odd chance that they will not, that they just cannot comply, cannot remember to wear their aligners, we give a guarantee that we will switch them to braces at no additional cost if that proves to be the case. In other words, Invisalign Teen, in my opinion, is a superior treatment option for most children and teenagers.